Why exactly does the medical world place such significance on the process of nasogastric or NG tube insertion? Well, the answer to this question lies in the myriad of critical applications this procedure has in the healthcare field. Whether it's for feeding, medication administration, or gastric decompression, NG tube insertion plays an integral role in patient care. Now, before diving into the step-by-step process of NG tube insertion, it's important to understand that this procedure should be carried out by a skilled healthcare professional. The process demands accuracy, patience, and a thorough knowledge of anatomy and physiology. So how does one go about inserting an NG tube? The first step is to gather all necessary equipment. This includes the NG tube, a lubricant, a syringe, a stethoscope, a cup of water, and a pair of clean gloves. Next, the healthcare professional should position the patient. Ideally, the patient should be in a high Fowler's position, which is essentially sitting upright at a 90-degree angle. If this isn't possible due to the patient's condition, a semi-Fowler's position at a 45-degree angle will suffice. Once the patient is properly positioned, the healthcare professional can measure the NG tube. This step is crucial because it determines how far the NG tube should be inserted. The tube is typically measured from the tip of the patient's nose to their earlobe, and then down to the xiphoid process, which is the lower part of the sternum. Following this, the healthcare professional can lubricate the tip of the NG tube and gently start to insert it through the patient's nostril. The tube should be directed straight back and not upward, as the aim is to guide it into the esophagus and not the brain. Now, as the tube is being inserted, the patient will need to swallow. This can be facilitated by giving the patient a sip of water. It's important to note that if the patient starts to cough or struggle to breathe, the tube may have entered the windpipe and should be immediately removed. Once the NG tube has reached the measured length, the healthcare professional should secure it in place and verify its position. This is typically done by aspirating gastric content and checking the pH or by auscultating the stomach while injecting air. In conclusion, NG tube insertion is a delicate yet vital procedure in healthcare. It's a multi-step process that requires meticulous attention to detail, a deep understanding of anatomy, and most importantly, a patient-centric approach. Remember, the goal is not just to insert the tube, but to ensure the well-being and comfort of the patient throughout the process.